Hey guys, welcome back to our channel, The Doctor's Diary. So we are back with another video on Medic-o-holic Series. Here's a short disclaimer from the FBI on federal law of fair use of copyright videos, graphics, and pictures. I got a small brain teaser for you. This time I need you to guess the topic. Need a clue? Sorry. Sorry again. Well, that was a clue. Any guesses? Not yet? Let's proceed. Are you troubled by a runny nose which keeps tempting you to check your temperature during the lockdown? Well, if you have done this or if you have been through this is the right place for you. We are going to highlight some distinguishing points between allergy, common cold, and coronavirus infection in today's episode. So seeing this picture, many of you may go, ew, but this is the foremost sign of allergy known as allergic salute. So these individuals will usually have a transverse line in the nasal crease, which is characteristic. Dark circles could also be present in these hypersensitive or allergic individuals. So the common signs, rather the common symptoms in these individuals would be headache, nasal congestion, sneezing, runny nose. And the other probable symptoms which may and or may not be present might include fatigue, sore throat, in some cases fever, and watering of eyes. Now, what I want to specifically signify at this point is that an allergy always requires a triggering factor that is known as an allergen. An allergen could be anything. It could be pollen, it could be dust, it could be anything in the environment or anything under the sun. Now, coming to the next section, the most commonly encountered ailment, that is common cold. Most of us would have had at least one episode or maybe more than that throughout the year or maybe any time in the year. So, what are the most distinguishing points between allergy and common cold? As you can see, the symptoms are almost similar to that of an allergy. As I said earlier, that for an allergy, it requires a triggering factor or an allergen, whereas for common cold, there is no triggering factor because it's mainly caused by a virus. Now, over to the villain of today's episode. Yes, you're right, the coronavirus. The coronavirus infection or the COVID-19. How would a patient or a person present with if he has been infected with COVID-19? Yes, you guessed it right. The person would be asymptomatic because 85% of the individual are asymptomatic and only 15% of them present with some symptoms. So your next question would be, then how would we identify them? Well, the first and foremost thing which you need to do is ask their travel history, whether they have been to countries or they have traveled recently to any of the country having a COVID-19 outbreak. If not, have they ever come in contact with anyone who has traveled recently? So, because of this, even many people, those who are flying abroad or those who are immigrating from there, are even escaping thermal screening because most of them are asymptomatic. Okay, now apart from them, the ones who are actually presenting with the symptoms, what symptoms would they have? The first thing, which is studied from the research, is anosmia. Anosmia means loss of smell. Now, coming to the other symptoms of coronavirus infection, which most of you would be aware of, even because every day, almost every day, you might have heard it in the college tune itself. It might have the patient may present with symptoms such as chills, body ache, breathlessness, nausea, vomiting, diarrhea, and fever, high grade fever, chest pain. So, if a person comes to you or even presents with any of these symptoms, what do you need to do? The first thing which you need to do is contact a healthcare system. You need to contact the doctor, you need to contact the um, nearest hospital first. So you need not to panic first in this situation. You need not to think that what would be in the future. But when you have these symptoms, the first and foremost thing is to report to a healthcare unit. So, remaining all about the treatment and everything you would have come across in the internet, you might have come across or maybe read many of articles. But we will keep updating you about this in our coming slides, in our coming presentations. Till then, arigato, meaning thank you in Japan. So that's all, folks, for today. Thank you. Do like and subscribe our channel, and don't forget to share the video to those who are having this query, or maybe to all of your friends. Thank you for your support. Have a good day.